So first, thank you all. We'll go ahead and get started. We have some folks here in the audience live with us. So this is officially a hybrid session. So thank you all for being here in this classroom setting at the wonderful University of Arizona. And thank you all for being here with us virtually. This is our third session of our Lunch and Learn. My name is Selena Barajas. I'm the Arizona Program Manager with Mountain Mamas. Mountain Mamas is a nonprofit. We're new to the state of Arizona, but the organization is not new to our nation. They've been doing work in Montana and Colorado. I have an amazing team, and we're building here in Arizona. So if you haven't signed up for our newsletters, or if you're not following us on social media, please make sure to stay in touch with us. If you here in the audience live, or if you're over there at home or at work, and if you want to do a presentation, a lunch and learn type setting, please contact me. When I started to think about these lunch and learns, it was really important for me as a mom, as somebody that's also learning a lot around clean energy and our environment. I felt like there's a gap having these conversations with moms that are very concerned, but just people in general. How can we have these very scientific conversations like we're going to have today, and how can we break that down? Dr. Chris Lim was actually one of the first people that I met in this type of space. A couple years ago, we met through an email, a professor here at the U of A, of trying to do some community engagement around some of the research that he's been involved in. And I was just blown away from all the research that you've been doing, not just here in Arizona, but from San Francisco to New York. And as an urban planner and somebody that loves to look at maps, he just displayed a map actually here on campus. And I was just like, wow, we need to dissect this here in Southern Arizona, in Tucson. And that's what the work he's doing. So I'm going to read a little bit about his bio, but I would love to give a lot more time to you, because it's a treat that we have Dr. Lim here with us today. So Dr. Christopher Lim's research examines how the environment impacts human health, applying a lot of research, a lot of scientific methods. Specifically, he is interested in the health effects of air pollution and climate change, and whether there are disparities in the exposures and associated health outcomes. He also explores the potential application of low-cost sensor technologies for personal level exposure assessment, urban air pollution modeling, and community-based environmental justice projects. And I've seen his work and his students' work in person, of doing some stuff along South 6th Avenue at some TUSD and SUSD schools, as well as the city of South Tucson. So thank you for that. And that's some of the work that maybe you might share a little bit today. So if you're interested, follow up with him. Currently, he leads a study examining the health and academic impact of green playground renovations in New York City public schools, and another study that will look at the impact of air pollution on pediatric asthma in Tucson schools. He completed his postdoctorate training at the Yale School of the Environment and obtained his PhD from NYU School of Medicine. And now he's here at the University of Arizona. So give him a bear down welcome. And it's the first week of school.
Yeah.
So I feel like I'm back getting my PhD with you, Dr. Lim. So take it away.
Yeah, sure. Thank you for the intro, and thanks for joining us today. So today I'll be sharing some of my research. So before we get started, I'm an environmental epidemiologist. So I try to look at the relationship between environmental exposures and health outcomes. So I'll be sharing three of my main projects. First, it'll be low-cost sensor technologies and how it's used to measure air pollution real time, including here in Tucson, Arizona. Another one will look at long-term exposure to air pollution and health outcomes across the US. And the third, a project we recently started looking at environmental exposures and 911 calls across the US. So emergency medical services. So my lab is called the Health and the Urban Modeling Lab. Our research theme is to combine epidemiology, statistics, and big data to answer the questions that's here on the slide. So what's the relationship between the environment and human health? That's the main question I try to answer in my research. which populations are the most susceptible and vulnerable to the environmental exposures. And finally, how will future trends like climate change and urbanization impact this relationship? We focus on different types of exposures here in my lab. So climate change events like hurricanes and floods, the natural and the built environment. So these are green spaces, walkability, and the food environment. Temperature, so heat waves, especially in Arizona, but also how temperature changes over time. Also interested in noise and how it impacts our health outcomes. And my main focus has been really in air pollution, so particulate matter, ozone, and NO2, which is really from traffic. So as we know, air pollution is linked with a host of health outcomes. So this includes premature mortality, cardiovascular diseases like heart attacks and stroke, respiratory diseases like asthma. But there's also a lot of recent evidence linking air pollution to diabetes, Alzheimer's, cancer, reproductive outcomes like low birth weight, and a host of other health outcomes. And through a strong body of research shows that vulnerable populations like children, elderly, and those with pre-existing disease are really more vulnerable to the impact of air pollution. And in the US, air pollution exposures really felt disproportionately in higher or disproportionately in low-income and minority populations. So this includes predominantly Hispanic or Black communities, low-income communities, but also tribal communities as well. So how do we measure air pollution? So traditionally, air pollution is really measured by expensive monitors run by the US EPA. They cost tens of thousands of dollars and they cost a lot to maintain as well. But recently, there's been recent developments in technology, and we use this to measure air pollution as well. So low-cost sensors can help us generate really big volumes of data at a fraction of a cost. And they're typically less than $300 per unit. So they're being used by citizen scientists, community organizations, but also government agencies to measure air pollution in our neighborhoods. So recently, US EPA started to use these sensors to measure wildfire smoke. California passed new legislation requiring their air districts to work with communities to establish community air monitoring systems using low-cost sensors as well. So they're increasingly more popular over time. So this is one sensor that I use a lot in my research. It's called Purple Air. They're $300 per unit. And you can install them on walls outside your houses or even indoors. So here's an example why government monitors are not sufficient to measure pollution. So this is San Francisco. On the left is a map of an EPA monitor. So within a city of like 1 million plus, there's just one monitor. And as we know that air pollution levels can vary really significantly over a very short time period. So like a car that's like standing still, that'll generate a lot of air pollution. And also air pollution can vary a lot block by block, very short distances as well. So this one monitor can't really capture that variability. So on the right is a map of purple areas in San Francisco. So these are all mostly run by citizen scientists installing these sensors and outside their houses. And they're sharing their data with the public. So we're able to capture the short trends in air pollution levels, but also the spatial variability block by block changes in air pollution as well. So here's a map of purple areas in southern Arizona. On the left is a screenshot I took a few months ago. So there's quite a bit of purple areas in our city as well. Not as dense as San Francisco. On the right is a map taken today. So we have a lot more monitors now, including in Sahuarita. We're working with community groups down there that's concerned about the new copper mine going up. So we've installed some Purple Air's in partnership with SWESEC here at U of A, the Center for Environmental Health Sciences. We're also working with a group down in Patagonia. There's also a pretty big mine going up, South 32 manganese mine. So we've installed Purple Air monitors down as well. And also within Tucson as well, which we'll discuss. So here's my students installing a Purple Air at the City of South Tucson City Hall. So we installed a Purple Air a few months ago with help of Selena and folks working at the city hall as well. So using this Purple Air data, we're able to again measure real time, really hyperlocal air pollution PM 2.5 levels as well. And we're again sharing this data with the public. A few years ago, I've also installed about 20 Purple Airs here on campus at U of A. Some pictures, one right by the bookstore and one right outside. And using this data, we created an online data dashboard that people can see real time what they're being exposed to. Unfortunately, a lot of the sensors are not working anymore because like people stole them or broke them, or it's been a long time since we installed them, so they just stopped working. But when we had a pretty dense network, we were able to see these like real-time changes and PM 2.5 levels. So on the right is right by Campbell and Speedway, and we're able to see the impact of traffic on air pollution levels. More recently, we are working with another sensor called QuantiQ Module Air. So these are a little more expensive. So they are $6,000 per unit. So the thing about Purple Airs is that they're easy to use and they're relatively inexpensive, but they can't measure the larger particles accurately, the PM10. That's a bigger issue here in Tucson, where there's a lot of dust and wind kicking up a lot of the dirt from like farms and nearby fields. So this program called Sunset was funded by US EPA and it's led by PDEQ, Piedmont Department of Environmental Quality, Natalie Shep, and U of A. Me and Dr. Ashley Lowe at the College of Nursing were also part of this project, but we've installed 19 of these monitors at schools across Piedmont County. And then the thing about these sensors is that they're able to measure larger particles, but also gases as well. So NO, NO2, which are from traffic, ozone, which is formed in the air. It's a big issue here in Arizona due to sunlight and heat and NO2 reacting to form ozone. So ozone is a big public health issue during summer times here in Tucson, but also in Phoenix. Before we install these sensors, what we have to do is we place them right next to the EPA monitors just to ensure that they're more accurate. These sensors also have some variability between the units as well, so we're able to adjust for that variability as well. So here's a picture of the EPA monitors on the left. On the right is the QuantiQ. So we put them right next to each other and let them run for about 2 months before we install them at schools. So ozone, so this is an example of the comparison data between the EPA data versus the sensor data. So they're pretty accurate comparing the two. So this is for ozone, comparing the sensor readings versus the EPA readings. And these sensors are also pretty sensitive to relative humidity, like rain, especially in heat. And we can also adjust for it in the model to improve model performance. And you can see that the relationship is pretty like strong between the EPA monitors and the sensor. So these are pretty accurate. We just have to kind of adjust for the between unit variability. And what we've done with these sensors is that we've created an online dashboard where people can access the data and visualize air pollution levels real time. So we've created this online dashboard. We actually have one sensor out in Ajo as well. So 19 schools total, and people can map and see what they're being exposed to, so we can compare levels, but also compare between different types of pollution like PM 2.5 versus ozone. So this is an example a few months ago where we had a dust storm come through town. So you can see from the PM10 readings, which are the larger particles, we are able to capture these like really huge spikes in air pollution levels due to this event real time and visualize what people are being exposed to. And as you can see from this map of the sensors, we have about 3 sensors out in Marana, 4 in Sunnyside, and then 1 in Sahuarita, 2 in Vail, and the rest across, 1 in Tanque Verde as well, and the rest in TUSD. And 1 at the library as well, the main library downtown. We're also able to visualize patterns across location and time, so people can see what are the trends and what are like the relative differences between each location. And we can also plot the air pollution levels as well. So we can select a couple of locations to compare, and you can map or you can visualize the air pollution level. So here on the graph on the right, you can see that at some of the schools we're picking up these like really high peak events, which are can be like something due to like a dust, like a wind blowing or some traffic that's, sitting right by the sensors. The next plan for this project is to actually create like a model predicting air pollution levels even at locations without monitors. So we're able to map air pollution across the whole Tucson and Pima County. So this is a plot showing the relationship between sensor readings and satellite readings. So using this relationship, we're able to compare sensor data against satellite data, and then use this relationship to apply satellite-based readings at locations without any monitoring. So that's we're working on this step right now, and hopefully in a couple months we'll have a prototype model that can visualize and map air pollution levels across the whole city. I also mentioned at the beginning that we're working with community groups down in Patagonia. So we're working with a group called Calabasas Alliance who are concerned about the big mining project in Patagonia. So similar to the Sunset program, we've installed Quantic modular units, about 10 units across Santa Cruz County, including Nogales. And we're using this data to, see what uh, collect real-time data and then address concerns from the community about what they're being exposed to. So again, this is for PM10, so we're getting really high peaks at some of the locations for the larger particles. So this sort of real-time measurements can tell people or let people know um, whether there are any concerning air pollution episodes in the community. So future plans for the sensor network is to expand this throughout Arizona. So again, we have a pretty dense network here in Tucson. Um, we've recently established sensors in Sahuarita, but with funding from NIH, we're a part of a team called SCORCH, Southwest Center for Resilience and Climate Change and Health. So we're working with libraries in Yuma to install more sensors. We'll be installing 8 PM monitors in Yuma libraries. We recently got funding through NIH for the Superfund grant to look at health impacts of mining dust. And so we'll be working with a community group in Navajo Nation to install these sensors right next to um, an older mine. Also working with ASU and SWESEC here at U of A. I mentioned that we're working with a group in Sahuarita to install sensors. We're trying to install more sensors to address their concerns. And in Benson, there's apparently a big aluminum processing plant that's being installed or being developed. So we're gonna start engaging community members there, or they've actually reached out to us, and we're working with them to install these sensors in their neighborhoods as well. And again, we'll be sharing all the data with the public, open data and public available online source. And then finally, another sensor that I've worked with a lot in the past is called AirBeam. So this is very similar to Purple Air, but the big difference is that people can carry this around with them. And it'll connect to your smartphone through an app, and you can visualize and map what you're being exposed to real time. And then you can also collect the data as you walk around, and it'll keep track of you via GPS through your phone. You can also share this data with the public and put it on a website called Aircasting. So this is what the Aircasting map looks like. This is in New York, so people can either install these air beams like outside their buildings like Purple Air, but also again carry this around with you. So what I've done in the past when I lived in New York was work with community groups and then use these air beams to address their local concerns, what they're being exposed to. So we work with a group called NYC Environmental Justice Alliance, and we train people and students on how to use these air beams. They're pretty like easy to use. You just have to connect to your Bluetooth. And we talk with them to get an idea of there are concerns about where the pollution might be coming from. So what we did was we designed a route where people can walk repeatedly through like a couple weeks during the summer. And the students and the residents, took these air beams and walked around their neighborhood a couple times, or um, not a couple times, but repeatedly throughout the summer, and collected data. And using this data, we were able to collect about 100 hours of sampling data. So the map on the left is the raw data we collected. And using statistical techniques and modeling, we are able to create this prediction map on the right. So you can see this like yellow spot on the map, which is like what we identified as the pollution spot in the neighborhood in the Bronx. And that spot is actually Hunts Point Market, which is the largest food distribution center in the world. So there's a lot of big diesel trucks coming in and out of the neighborhood. So it's a big pollution source. There's traffic 24 hours a day. So and this was our initial concern as well, that they're being exposed to a lot of pollution from this big transportation hub. So they were able to take this collected evidence and engage their local politicians and policymakers, and then try to, here's the evidence we're being exposed to pollution from this major pollution source. So they're able to use this real-time data to actually make policy impacts. Any questions on the sensor stuff so far? Yep. You mounted? No, we don't have one. That's operated by us.
The side being sprayed for the control.
Yeah.
These are the answers.
Oh, really? Okay. Okay.
There's that one school. Anyone?
hmm
I'll see two. One question.
Okay, sure.
Does anybody else have any questions before we go?
Oh, yeah. So just an overview again of the sensor related stuff I'm doing. So future plan is to link the exposure data from the sensors to actual health outcomes, like hospitalizations or asthma. The overall goal is to provide actionable open data to the public and the communities. And again, this real-time, like hyperlocal data is really helpful to identify potential sources, but also see what you're being exposed to, and ultimately protect public health. And then again, this data allows people to engage multiple sectors, including, politicians, but also pollution, the sources of pollution, like companies or nearby major sources. So here are the links to the data dashboards I've shared earlier, so you can check it out. And then I'll move on to my actual like epidemiology research I've done in the past. So again, I'm an environmental epidemiologist. So I look at health outcomes associated with environmental exposures, mainly air pollution. So in the past, I've done long-term exposure studies. So during my PhD, and still currently, I'm working with this data set called the NIH-RIP Diet and Health Study. So what we do in this core study is we recruit people, or NIH recruited about 500,000 people across 6 states and 2 cities. And we follow them over a period of time, and then we keep record of like when they die, when they get cancer, etc. And usually like this study is used for answering questions like, is like coffee good for you? Or is eating a lot of vegetables, like, does it protect you from cancer? That's like the traditional. So this is what these like long-term cohort studies are for. But we also know where they live. So we're able to link that to air pollution estimates. So again, 500,000 people follow-up period from 1995 to 2011. We also have more recent data to 2020 now, mostly older, retired, majority white, but population. So we have really detailed information on their demographics. So for each person, we know their age, sex, race, marriage status, BMI, education, their dietary patterns, whether they smoke or not. Again, since we know where they live, we can link that to their neighborhood, like median income level, racial distribution, education status as well. So we are able to adjust for all these traditional predictors of mortality. We can also link that to air pollution estimates using models and satellite data. So using this cohort data, we linked it to PM2.5, ozone, and NO2, using information from models and satellite estimates. So in my previous study, we found that long-term ozone is associated with increased risk for cardiovascular disease, ischemic heart disease, and also respiratory diseases and COPD. So long-term exposure to ozone will increase your risk of mortality due to these causes. So the way to interpret this is that per 10 ppb increase in ozone, your risk of heart disease mortality will increase by 3%. So higher, so that if it's like 20 ppb, it'll be like 6%, for example. And on the right is PM2.5 and NO2. I didn't really highlight this here, but they're also significantly associated as well. So this is what this relationship looks like when you plot it out. So higher ozone exposure, higher mortality risk for both cardiovascular and respiratory. I mentioned in the beginning or earlier that we have information on their dietary patterns as well for each person. So for members of this cohort, when they enter the study, they answered a questionnaire. So we're able to quantify like how healthy their diet is. So what we did per person is to create an index called the Alternative Mediterranean Diet Index. So this measures how healthy your diet is. So if you eat more fruit than the average person, you get 1 point. If you eat more vegetables than the average, you get 1 more point. So it's a 1 to 9 point scale, adding all this up. So 9 means your diet is very Mediterranean, very healthy. 1 means your diet is really not healthy for you. So using this information, we try to see how dietary patterns modify the relationship between air pollution and mortality risk. So on the plot on the graph on the top shows on the x-axis is the Mediterranean Diet Index broken down into 5 groups. On the y-axis is the risk of mortality associated with air pollution. So you can see that for people in the 5 group, which is the healthiest dietary pattern, the mortality risk associated with PM2.5 NO2 is low compared to 1 group, which is like the least healthy dietary person or dietary group. And this is for cardiovascular disease, ischemic heart disease, CER, this is stroke, and then CAR, cardiac arrest. So these are different types of cardiovascular mortality. So what this shows is that healthy diet can protect you against air pollution impacts for cardiovascular mortality impacts. And this relationship is pretty like clear to see as well. Healthier diet, lower mortality risk for air pollution. And once we break this down into each component of the diet in the Mediterranean Diet Index, it's really the fruit consumption and the vegetable consumption that's really protecting you from air pollution. So how air pollution impacts human health is that it causes inflammation and oxidative stress. And we know that vegetables and fruits are, they have a lot of vitamins and they're anti-inflammatory, so that it'll protect you from the harmful impacts of air pollution. So one way, the conclusion from this study is that one way to protect yourself during like high pollution episode is to just eat healthier than usual, veggies and fruits especially. And then in this cohort where, again, since we know where they live, we can link that to other environmental exposures like green spaces, like trees and parks, but also walkability as well. So in this cohort, currently we're linking features of the built environment. So NDVI, this is a measure of green space, and then walkability, like how easy it is to walk outside. Tucson, not very walkable. Chicago, a lot more walkable. So this is like a number that tells you how easy it is to walk. So right now current study I'm leading right now is looking at how the built environment will impact your cancer risk. So on the left is green space. So if you live in a neighborhood with higher green space, your risk for certain types of cancers are significantly decreased. So the line in the blue means that it's significant. So esophagus cancer, liver cancer, and respiratory cancer, we're seeing some protective impacts. On the right is for walkability. We're actually seeing higher walkability, higher risk of cancer. We think it might be due to air pollution, more higher exposures, but we're trying to still explore that hypothesis. But again, where you live will really impact your cancer risk as well. Yeah.
But you said higher walkability,
Uh-huh.
so like walkable cities,
Mhm.
percentage in like metropolitan
Mhm.
areas
Right.
equals like higher cancer rate.
Right.
Oh, wow.
Mhm.
I'd have thought the opposite.
That's why we thought to, again, we're trying to see like if there's any like interaction between air pollution and walkability and see what the impacts are, but it was a surprising finding. And we're working with other researchers at other schools to use like measurements from Google Street View, for example, to quantify like where you live with more detail. So they're using machine learning to take pictures of like people's surroundings and quantify this percentage of our view is a tree, for example, versus like roads. And we're able to try to link that to the cohort and see if that makes any differences. Study design. So again, we're trying to see in purple different features of the built environment. So like urban design, green space, housing, race, income, immigration of composition of the neighborhood. Food environment is also a big one. So we're trying to combine all these different features and see if how that impacts cancer. And then any questions on this? Yep.
Yeah.
Yeah.
Have you been able to like create any like correlation between metropolitan cities that have really strict, like they don't have as many rollbacks on like more mass carbon, like endangerment planning, like different things that create more pollution compared to cities or metropolitan areas that don't have as strict procedures?
All right, that's a good question. No, I haven't really thought of that, but that'll be really interesting to pursue. Yep. Yeah.
So if it's higher walkability, if there's more concrete and sidewalks with less green space.
There's no like complete, it depends on the city in the terms of like relationship with green space, but there's more sidewalks. It's like what that index measures, like sidewalks, how dense the blocks are, like presence of intersections. That's another feature.
The increase in diet
Mhm.
confers a higher ketone diet and higher protein diet.
Uh-huh.
You see increase in cancer,
Um,
or they are protecting from air quality.
So we didn't see a lot of, so we can go back. So again, like red meat consumption is one of them, one of the factors. So we didn't see any like relationship, but other types of, we could measure other types of features of the diet, like high fat content or white meat. We do have that information. We selected these because they're like the component of that Mediterranean index, but we could explore that further as well. But I don't know the answer to that.
Yeah, really huge debate right
Uh-huh.
now. Plants and that plant-based diet versus a ketone diet
Mhm.
and then.
Yeah, that'll be interesting. Yeah. Mhm.
But you said that there's no correlation between red meats and cancer.
No, there is, but in terms of like air pollution, impact on the air pollution, impact on
Okay.
health. Uh-huh.
I was like,
Yeah.
see.
So the final project I'll discuss, that I recently just started is looking at environmental exposures and 911 calls in the US. So climate change will stress EMS systems. This is like the frontline public health infrastructure. This is like the people that respond to on health event. So, but there's a lot of evidence gap and knowledge gap right now. So we don't know what the national burden of environmental exposures on EMS is. Most studies have looked at like one cities or one state, not the entire US. So we also don't know what the trends are and who are the most vulnerable. So as part of the study, we're linking air pollution and temperature data to NEMSIS, which is a national EMS information system. So this data set is collected through all 50 states. So, and there's about 50 plus million calls per year that's gathered through the system. And about half those end up being transported. This data set's great because it tells you like where people are calling from instead of like homes. So for example, using this data, we're able to see number of asthma-related EMS transports from schools by hour a month. So we're able to get a specific location of where people are being impacted, as well as like the temporal and the spatial trends as well. So the NEMSIS keeps track of a lot of health outcomes. So on the left is the heat-related EMS activations that, again, they share this publicly online. You can see which counties, which zip codes are most impacted from heat. It's usually Arizona, not surprisingly. I forgot to take this out, so I put RIP there because this dashboard got taken down when the new president came in, and then it's back. It just came back a few weeks ago. But again, this was gone for the longest time. And then the drug overdose dashboard is also publicly available as well. So you can see trends in 911 calls due to overdoses. But I'm using this data to answer the question of what are the impacts of air pollution, what are the impacts of temperature. So what I found in my preliminary results so far is that heat-related EMS calls are increasing. So from 2019 to 2023, they increased by 17%, whereas non-heat related EMS calls increased by 11%. So heat-related calls are increasing faster than general EMS calls. We're also seeing some pretty strong disparities across age, sex, and race. So the map on the right shows that. I can move that. So this is this is the age group. So not surprisingly, it's really the oldest population that has the highest risk of heat EMS calls. So that's plot A. Plot B shows that there are sex differences as well. It's really there's higher risk among males. We think it's because they work outside more compared to the female population. And we also see some racial disparities as well. So we're seeing the highest risk in Black population, Pacific Islander population, and also the Native American population. And the second column, DEF. So we also tried to again compare heat EMS versus non-heat EMS activations. So for surprisingly for age groups and sex, the growth of heat EMS calls relative to non-heat EMS calls is pretty consistent. But for the racial breakdown, we saw that the Hispanic population has the highest increase compared to other races and ethnicities. So this is a pretty surprising finding. Again, it might be due to the higher prevalence of like outdoor workers in the Hispanic population, but we're trying to kind of tease it apart a little more in terms of why we're seeing this trend. And then finally, we broke this down geographically. A is again just the overall percentage increase in heat EMS counts. So seeing the biggest increases in South, like Texas, Oklahoma, Louisiana, Arkansas. Well, again, when we compare heat versus non-heat, surprisingly in like Southeast, we're not seeing that increase. We think it's because maybe people are more used to the heat there compared to other parts of the city. New England, we're seeing a decrease, and we're seeing the biggest increase in, again, the South, also Midwest, and also West as well, Arizona and states above.
And so you're saying increasing because of contamination and pollution as well, right? Like, there's a correlation between like pollution, high amounts of pollution equals.
Yeah, that's a great question. So we haven't actually started analyzing like the air pollution impacts on EMS, but like you said, they're related usually, right? During like heat summers, the ozone's higher. So we think that's the case, but we haven't gotten there yet. But that's a really great point. And then since we know like when and where people call, we're able to see what time they call, for example. So most of the heat related calls are the late afternoons, not surprising, from 12 to 6 p.m. We saw that again, most heat calls are during summers, but from 2019 to 23, the proportion of heat calls actually increased or proportion of heat calls during summers increased from 45% to 52%. And most of the heat calls ends up in transport to the nearest hospital. And surprisingly, I forgot to put this on there, but most of the heat calls are also made indoors, about 60%. So we were expecting the opposite, but most of the heat calls were indoors. We think that's because maybe elderly are more affected and they're not getting the air conditioning that they need. So yeah, yep.
But the increase in accessibility to phones and mobility of phones,
Uh-huh.
is that also, like, are you looking at that as a measurement?
No, we don't have that information, but that would be like a hypothesis, like where people can actually call 911 from. We would think that would have an impact, but we don't have like a way to answer that.
So, right in their hand. all the
Right,
time.
yeah. Mhm.
Wow.
Yeah, any questions?
Let's give Dr. Chris Lim a round of applause. Take out your pencils, I'm just kidding, we're gonna do a pop quiz. No. We're gonna do a final right now. Yes.
How this climate change affect like other services and
Right.
how we have to be prepared for all those also.
Yeah.
Yes.
Thank you so much.
And for everyone that's here with us virtually, if you have a question, if you want to pop it in the Q&A area, and we could answer that, if we'll give you all a couple minutes to ask, but if anybody here has questions, and then I would love for us to kind of introduce ourselves, and because we have an amazing room here. But I just want to thank you. You know, when I first saw this presentation, it wasn't as intense. Then the first time was more of the maps from San Francisco that I remember seeing, and that was like 2.5 years ago. So it's awesome that you're like expanding your research. So thank you for bringing that. Let's see. Did you all learn something new too? Okay, I don't think they have any questions online, but
Yeah.
Going back to the first project you shared about with the sensors, working with Pima County and TEQ, especially the sensors that are in the schools, is there any effort, this may be out of your scope of the project, but with the project as a whole, on engaging the school population, the teachers, the students, on how to engage with that data and like as a learning tool for them?
Yes, that's a great question. So one of the main purpose of the grant and the project is to do that exactly. So Natalie's team and then Dr. Ashley Lowe here, they're developing like an education module to teach high school students about air pollution, data, and the health outcomes. Yep.
To just piggyback off of that, I know that I work with you two up in Maricopa County. I was having conversations with teachers about how they engage students to like be able to understand this. And like they're like, oh yeah, we're trying to make it so that students don't go outside whenever we're reaching like peak air quality, like purple or like the specific zones. I was like, wait, so when are they gonna go outside? Right? Like it's always like that. Like I'm curious what you're also like once you create this study, like what is your methodology of like taking action?
That's a good question. So that's a point that we've heard a lot as well, like engaging with teachers. So I think something that's more, usually they get the information from, again, monitors that tend to be like far away from their school. So having something more local will be a lot more helpful, I think. That's real time as well. And then developing more of like a detailed plan on what to do as opposed to something more general like that would be one of the next steps we're trying to do as well, and then spread that information out to the schools here in Tucson. But that's a big issue, like I said. Yep.
So are there ways to become like how could I or can citizen scientists that help?
Well, that's a good question. So hosting a sensor would be, I guess, one of the most direct way, but also just engaging people around you about the issues that we're facing in terms of air pollution. Mostly air pollution related to my research, but just sharing this information and then this resource that we're developing, just having that spread as well would be really helpful. It's a very in the prototype mode right now, but once it's more like official, just having that word out there would be really helpful as well.
And two, with Mountain Mamas, you know, my big thing with doing these lunch and learns was to bring people to the table, you know, mamas are at the table, at the table, like my shirt says. But we've had like the Arizona Youth Climate Coalition, or just Mom is here with us. You're always our special guest, thank you. And we had, you know, yes. Oh, yeah, see, we have a celebrity in the house. We did Mom's Clean Air Force, the last one, and one of the questions that we got in that session was, the mom said, oh, this is, now I kind of know, maybe this is why my daughter had asthma, because her school's right off the freeway. So now with your presentation, kind of like bridging those connects, and, you know, we'll have time to introduce ourselves in the work that we're doing or just why you're here. But my hope is that with your research, then we could share that and maybe have like a focus group, you know, with the students, with the parents, with the teachers, because that's what really intrigued me to see, like you were saying, you know, or somebody said with the sensor, you know, the kids see that from other cities, but to have something right there in their backyard or at their school site, I think it's really impactful, and then it gets the spark going. Because I know when I first saw this presentation, it really went over my head the first time when I saw the maps of San Francisco, but I couldn't get, now when I drive down different corridors or different school sites, I'm like, I wonder if Dr. Lim has an air sensor here at this school site. You know, it's right off the freeway, or it's really sprawled out on the other side of town. So we'll stay in touch, you know, with your research. And I'll just double check, because if there's no questions, oh, we do have one question. Are the purple air monitors available to the general public? Thank you, Susie, for that question.
So you do have to purchase them, but sometimes actually libraries here have sensors you can also loan. The air beams, they have them, you can also borrow. Purple Airs through the SWESTEC here, they have like a sensor library that you can also check out sensors from. So there are resources that you can leverage.
Awesome. And I just love how your research tied back into our health. You know, sometimes we don't connect the dots on that. So we'll keep the conversation going. I'm gonna go ahead and take you all off that are virtually, so we can eat pizza without you here. No, I'm just kidding. I'm gonna take you all off. Thank you for joining us. This will go up on our YouTube page, so you could share it, you could rewatch it, you know, you could take notes, follow up, and stay tuned for a future Lunch and Learn in September. Yes, we're already almost in September, so stay tuned for the one in September. Thank you all for joining us online, and make sure to follow Mountain Mamas, our listserv, and our social media. Bye, everyone.